Get this burden off their back to make the costs 10% of payroll a predictable cost, a budgetable cost, so that they can make hiring decisions and they can make capital investment decisions with confidence that they know their costs are not going to skyrocket year after year after year. My university is looking at a 20% jump in healthcare costs with IBC, 21%. And by the way, much of that cost, as you all know, is attached to Wall Street losses by the insurance industry. How dare they raise our premiums because they're losing money on Wall Street? Employees want the benefit of guaranteed health care so that they can change jobs or they can go back to school for retraining. But how many of you know how many people are attached to jobs only because there's health insurance attached to it? I talk to a lot of people on Capitol Hill and Harrisburg, and they honestly tell me that as well. Fifth, we want to reduce the cost of defensive medicine. The question surrounding medical malpractice. If you look at the model of Canada back in the early 60s when they went over to single payer, they saw their medical malpractice insurance costs go down 80%. And we're not predicting 80% drop in medical malpractice, but certainly it is going to be dramatic because right now physicians and hospitals provide testing that is medically unnecessary. It's clinically unsound. They're pushing people to MRI units because they're trying to pay down the cost of those MRI units. An MRI procedure in the United States costs $1,200. In Japan, it's $100. In the EU, it's $113. The certificate of need element in Kathy Mandarino's bill will address this issue. Sixth, patients get to choose their providers. This genuinely is, and I think Representative Sterla put it well at the beginning here, this is a centrist solution because it borrows an idea of the left, which is public funding, and an idea of the right, which is private delivery. People want a consumer-driven campaign. They want a consumer-driven healthcare system. Let people choose their providers. Let them vote with their feet. It's a centrist solution because it brings a traditional idea of the left, public funding, and an idea traditional to the right, private delivery together. A centrist solution for all.